So, Carol, you are an LPN, right?
Yes,
Okay. And how long have you been an LPN
I have been an LPN for 23 years.
for? Okay. So you've definitely got experience in it.
Yes, and I was a CNA for 5 years prior to that.
Oh, okay, okay. So you've been in and out of the healthcare field for a while. Uh,
Yes.
what type of fields have you worked in? Have you worked in hospitals or go ahead?
Mostly I have done long-term care, geriatrics,
Okay.
but I have done some prison work. I have done agency where I kind of hop between hospital and nursing home, clinic, that kind of stuff.
Okay.
I've also worked in a clinic as a clinic office nurse, phone nurse, and I have also worked with neuro patients who are either brain injury, spinal injury, or some are behavioral, like DD patients. And then I now work in home health.
Okay. Uh, Now, you said you've worked in prison work before, so I would imagine that you've had your hands full with that. When you're working with your clients, like your clients today, um, uh, can you give me any idea about the differences between the kind of work you used to do and the kind of work you do now?
Well, one of the big differences between prison nursing, just which is where I started, other than being a CNA in long term care facilities, working in a prison, and where I am now with home health. In a prison, unfortunately, you basically have to shut off like any kind of empathy or care at all.
Understandable, absolutely understandable. Um, uh, you said you worked in neurological settings as well. Uh,
Mhm.
are there any kind of connections you could have between your prison work and working in a neurological setting?
Yeah, actually, we would have patients that were um, like recent releases
Hmm.
to like the neuro unit because they had more behavioral psychiatric, and they didn't really deem them, either they were released like probation, but they weren't deemed to be out in the community yet. So we would sometimes get patients that would be released from prison into our facilities.
Okay, okay. Uh, I've I've worked in the neurological field as well, so I absolutely understand what you're talking about. Um,
Mhm.
uh, we'll just jump straight into it. Have you ever had any instances of violence against you during these times?
No, actually,
Oh,
I didn't. I actually did pretty well with my patients, kind of connecting with them and making sure they understood that I was there as a nurse and not, same thing in the prison. I was a nurse, I wasn't their judge and jury. Like, that was beyond my scope, and I was just there to take care of them. Of course, they get hyped up, but never physically violent toward me, no.
okay. What kind of behaviors did you usually have to deal with on average?
Oh my goodness. Lots of swallowing things like batteries, anything, anything they could get their hands on. I can specifically remember a patient being sent to the hospital, and there's a process, but when they were at the ER decided to release them out into the public instead of calling the facility and saying, hey, they're ready to go.
Oh boy, I've
And the
had that.
patient actually, yeah, and the patient actually ended up at KFC sitting on a table with a coffee pot that he broke swallowing the glass.
Oh, wow. That's wild. I mean,
Yeah.
it's such a common thing, whenever especially when you're working in a neurological field of, having people that, do like to swallow stuff. That's really interesting. Uh, were you there for that whenever, when it all went down, or?
I was there when he was released, but I was at the facility. I wasn't in the like restaurant. The police, obviously, um, the county police were called
Okay,
and
okay,
called to the restaurant himself. So none of the facility was there. But yeah,
okay. Um, whenever you've had to deal with a behavior like that, how does that make you feel?
a lot of times powerless,
Hmm.
like I not being able to fix it. Very much out of my depth. Like this is so not what I went to nursing school for, and I am so not a psychiatric nurse. Um, but yeah, very powerless to help them and be able to like do something that I mean nobody normal does that. Like normal people, doesn't matter how much you want to fake behaviors and say these people are faking or they're acting, just acting out, whatever. Nobody normal does that. Like a normal person does not think in their head, I'm going to swallow glass. I'm going to swallow batteries. Like that's not normal.
Absolutely. When you finally got your client back, did you have to deal with any? Was he bleeding or anything from swallowing the glass, or?
Actually, we never got him back after that. He ended up being shipped to a different facility that was like, okay, you're not where we were at, was not capable of dealing with what he had and what he was dealing with. So they moved him another place.
Very nice. Did you agreed with them that he needed to go to a different facility?
Oh, absolutely.
Was that one of
We
those?
said he needed to go to a different facility prior to that.
That's what I
Yeah.
was going to ask you. Was that one of those that you felt like he should have been there before then in the first place?
Yeah.
Gotcha. Have you ever run across anybody that you've had to deal with similar instances when uh, not necessarily swallowing stuff, but somebody that had a behavior that they just could not break free from?
Um, I mean, yeah, you deal with patients like, even elderly, like picking or like picking at scabs and sores,
Okay.
um, not being able to, like, their mental health not being good enough to keep their house clean. Working in home health, I see a lot of places that are like roach infested,
Hmm.
or I mean, I've literally changed a dressing and watched a roach crawl across my field. Try Yeah, it's happened. Like walking, having to wear shoe covers so that I don't step on feces that's in the floor. Like,
Mm.
and it's not, to me, like nobody. Again, back to the whole, which nothing's I don't know what normal is, but nobody normal or in their right mind lives in that state. Like they're not intentionally,
Hmm.
like they don't know how to fix it, or they don't have the financial resources to fix it. Like, so yeah, I've dealt with a lot of behaviors. The prison, dealing with prisoners who I've had, prisoners that cut their penis on me, just so they, like that's a behavior to them.
Hmm.
Or I watched a guy literally kick, God, I don't know how, but kick the concrete stool for their desk out from the floor with the rebar, rip it out, and batter ram a prison door. and sit in the officer's pod and watch the door like fly off the hinges on the bottom. Like, again, nobody normal does that.
Yeah,
Like, that's not a normal behavior.
absolutely. Yeah, psychotic strength is a real thing, you know. Um,
Yes, it is.
have speaking of which, you know, you've obviously, you know, you've witnessed people who've, you know, had psychotic episodes in front of you. Um, do you think that, you know, in a lot of those instances, do you think that those people are getting the proper type of psychological care, or do you think that there's probably something lacking in that?
Um, I can honestly say the prison really did, surprisingly they tried.
Mhm.
Honestly, I think sometimes they were given a little too much leeway because they were psychiatric or whatever. Sometimes it wasn't, and you were acting out, and other times, kicking a stool out from the floor and batter ramming the door. Like, that is definitely. I mean, they have the medications, they had the psychiatrist in place, they had the counselors. I mean, they gave them every recourse to try to fix it, but
Mhm.
I think I don't know that there is um, enough medication in the world for some of those cases. Like, there's just not enough medication.
Understandable. Understandable. Have you ever had you ever uh, envisioned somebody maybe gaming the system? They weren't actually quite as sick as you thought they might have been, or
All the time.
okay, okay. Can you elaborate a little bit on that without anything specific?
Having inmates, quote unquote, what's called cutting, which is exactly what it sounds like.
Mhm.
Just so they can get a TV back, get certain privileges back. Um, Patients, elderly patients,
Mhm.
in the home health world, that, the second they realized, oh, I'm all better and I'm getting ready to lose my services, oh, I'm going to load myself up with a bunch of sodium, salt, whatever snacks, and throw myself into heart failure and go back to the hospital
Ah,
so they get the services back again.
wow.
So,
I
yeah, it happens all the time.
I love talking with nurses about stuff because you guys have such a different view on things. You know, but at the same time, I said you guys are, you know, you're right there ground level with the rest of the people. You know, are, you know, they basically paper readers. You know, like you guys are right there in the mix with, you know, with the dirt of, you know, of everything. So, you know, it's absolutely fascinating to hear, you know, stuff like that. Um, uh, were there any common triggers that you've come across that, you know, set people off around you, or was it just you know, more of a uh, just their regular everyday behaviors?
Um, some were just everyday behaviors. You know, I have had patients who were, like diagnosed bipolar, manic, depressive, and our personalities didn't really match.
Mm-hmm.
I was more, I'm more of an assertive. I'm, calm and quiet and sweet, but at the same time, I have a very strong, dominant personality, and they didn't like that. So
Mm-hmm.
they, automatically kick back to you and don't like you. And I actually had one patient that literally told me she didn't want me back because I didn't like her baby kitties.
Oh,
And all I said was I didn't want to see the baby kitty because I was there to do a job, and I didn't have time for that. Like, I
wow.
needed to get my work done. But that was her excuse for, not bringing me back, which, okay.
And you know, like,
I'm not bitter about it, but
yeah, yeah, you know, you got to kind of let those roll off, and go on to the next one. Um, did obviously, I'm sure you've had training in de-escalation and stuff like that. Did you find any of that training to be helpful, or was this just you just have the natural knack of being able to cool people down?
I'll be honest, I don't know that I even remember half of the de-escalation
Oh,
stuff.
okay.
I think it's just, I think a lot, I think nurses are empaths and they can feel and understand what other people are feeling.
Okay.
And so they feed off of that. Um, so they, it's kind of the whole match energy. We're going to match energy. You decide how we're going to behave today. So I think most nurses that I know are very empathic and can, figure out, okay, this person needs a little more, calm and quiet and motherly. This person needs a little more assertive and strong. So I think you just feed off that person. That's kind of where the whole psychiatric and you getting frustrated makes them worse. Just because like they feed off of energy.
Absolutely. Have you ever had an instance that you thought someone was actually pushing someone too far, and so you had to step in?
Um, I'm sure I have. I can't think of any specific event, but I mean, I've had, instances where I felt like maybe, a CNA or another nurse or whatever was just maybe a little too frustrated and so you pull them away. But I can't think of anything specific. But yeah, I mean, we've all had those instances where you just have to get them away and,
Mhm.
or tag in or whatever.
And as an LPN, you guys, uh, when you're dealing with your administration and stuff, do they listen to what you have to say about your clients?
Sometimes,
Okay. Okay. It's not a consistent,
not all the
but
time. No.
okay. Are there any things that you would change about, the way your specific role in healthcare works?
um, no, I mean, I think, I don't know, let me think about that one. Maybe a little bit.
Okay.
I think they need to, administrative and corporate, whatever, needs to really listen to nurses more when it comes to things that need to be done, the things that are actually important, like, I, just an example, whiteboard rounds in hospitals and corporate and administration thinking that's important. I get it, it's important to theirs, but to us, that is the last thing on our mind.
Mhm.
On our mind is patient care. And, oh, what did it do? Okay. Sorry, hand gestures
That's
apparently.
all right.
I think that they forget that this is not, as much as they say it's not for profit or whatever, like they forget that this is not a moneymaker and
Mhm.
this is actually about people's lives.
Absolutely. Uh, well, what was I going to ask you? Oh, I'm sorry. Uh,
Okay.
have you ever had to deal with any type of verbal abuse from clients or
Yes,
patients? Okay.
all the time, a lot.
Okay. Is that one of those things that you just kind of try to forget about, or have you ever had anything that you just couldn't shake from that day?
I have. Um, I've I've had to call the police because of patients or
Mhm.
patients' family members. Um, I've had patients that, just screaming, yelling at me or whatever, and I'm just like, you know what? No, I don't get paid enough for this. It's, if they're demented or they don't know what they're doing, that's one thing. But when you're in your right mind, which again, a lot of this stuff, nobody normal does that, but whatever. But if you're in your right mind and you're screaming and cussing at me, no, I don't make enough for this.
Absolutely. That's part of the violence in healthcare today. Like that's something that practically everybody in healthcare has had to deal with. I think when we looked it up, it said it was like 86% now that
Yeah,
healthcare workers were dealing with some form of violence, and that trauma carries with you. And
it
you know
does.
what are some of the things that you do to help you not necessarily forget about those things, but to get you to the next day where you can actually look forward to going in.
I drink. No, I'm kidding. You're on to it. No, I mean, honestly, I think for me, I remember that the good has definitely outweighed the bad.
Mhm.
Um, my uh, my mom just passed last August, not quite a year ago, and I I took care of her with my sisters
Mhm.
up until the day she died, and it's something I've always kept in my mind even before she got sick. My dad was sick when I used to work, in the skilled facility that I worked with Andrea at. Um, I literally like that's somebody's dad.
Mhm.
That's somebody's mom. So the good times, them thanking me, the family, thank you for everything you do. Thank you for, taking care of my dad or whatever. Like those to me in my mind always outweigh the bad.
Okay. Okay. I can go with that. Uh, so uh, you're talking about even before you were an LPN as well, right?
Yeah, yeah. I was a CNA at the nursing facility and also an LPN and an LPN supervisor at the same facility as Andrea. So I kind of worked almost all levels other than the RN part. But yeah, I honestly yeah, it's always been something that's been very near and dear to my heart, and so that is the part that I remember, and I try to forget about the crazy. But it's hard.
Oh yeah.
You get burnt out. You feel, especially after 27, almost 28 years, like you feel the burnout, and you feel like it's just not worth it anymore. And I just, if you don't care, why am I caring? Kind of thing. So
Do you think that staffing can be a problem at some of these fake places as well?
very much so, very much so. That plays a very big part in not only nursing violence, because we don't have enough staff to protect us and keep us safe and keep the patients safe so they don't feel safe, so they act out. But also in the burnout and feeling like there's just way too much being put on you.
Absolutely. Uh, I think every single person that's in the healthcare field kind of deals with that, in one way or another. Um, uh, since we're talking about staffing, do you ever come across staff that don't quite fit what you think they should be fitting whenever they're working that job?
Out 100,000% yes. Like, why in God's name did you become a nurse or a CNA or looking at them going, yeah, you're just here for a paycheck, or going, how did you make it out of bed this morning,
Hmm.
let alone into this role?
Hmm. Yeah, and they a lot of times, you see the administration, they don't really even care about that. They just kind of throw bodies at the situation. Like
Yep,
at
there's
least that's
not
been my
more bodies in the
experience.
building.
Yeah. Uh, uh, if you could change something about the way your companies you work for, nothing, no one specifically, but uh, about the way their hiring was, what would you change?
Um, one would be definitely more money. I think that is one of the biggest things that causes the staffing issues
Mhm.
and getting just anybody in there. So I think that's one thing that I would definitely change. Two would probably be more peer on peer interviews,
Okay.
and the trial basis. Like, you get that whole 90-day probation, whatever. I think that should be shortened to, 30 days or whatever, and, they should be put through the ringer and tested and with nurses that are actually going to do something about it.
Mhm.
Saying they have a 90-day probation and they call in every 5 minutes and not doing anything about it does you no good. Having, CNAs in the building that are asleep and you don't do anything about it and tell patients, yes, so, yeah. Um, and tell patients wander off and get lost and freeze to death. I mean, these are stories that are in the media.
Absolutely.
Patients that have, froze to death because nurses aren't there at all or they fell asleep or
Absolutely.
whatever, CNAs, and, then not do anything about it. And they knew, like, administration knew they were sleeping and it's been reported and they did nothing until that patient's dead and then all of a sudden everybody, it's coming down on everybody. Hell's about to rain down because they fucked up, excuse my language, sorry. They messed up and they didn't do anything about it beforehand. So I think a shorter probation period where they have to be, monitored a lot more closely and with actual repercussions.
Yeah, I can totally agree with that. And when administration turns their eye to the problems that nurses are confronted with, a lot of times like you guys are right there. You've seen what happens, and that's when the tragedy is getting ready. It's just building up and getting ready to happen. And if they just take the time, listen to what the ground level people are saying, not necessarily that you guys are direct ground level, but you're there in the trenches, so you know what these guys are doing, what they're getting ready to do, and if they just listen to what the people were saying, there'd be a lot less tragedies happening in these facilities. So I
Yeah.
absolutely, I totally understand where you're coming from with that, Carol.